dementia researcher with a blog and a rating.
Learning from experience to develop MCI Core Outcomes. My name is Victoria and I'm an early career researcher at the Bristol Brain Centre in Southmead Hospital. Over the coming months, I'll be sharing regular blog posts on our project that aims to influence which research outcomes clinical researchers include in their studies which involve individuals with mild cognitive impairment. We'll do that by spending the next year developing a core outcome set. In our first blog, I covered what a core outcome set was and why we needed one specifically for people living with mild cognitive impairment, or MCI. In today's blog, I'll explain how we're going about developing the core outcome set by involving those who understand MCI best, patients and the people who support them, both clinically and in their day-to-day lives. We don't want to miss any potentially important outcomes in the core outcome set. So we've developed a multi-stage process so we can learn from research that's already taken place and from people with experience of MCI. The study involves 1. An umbrella review to see what outcomes have been previously used in MCI interventional research. 2. Interviews with stakeholders to identify which outcomes matter most to them. 3. Synthesizing outcomes from the review and interviews into a long list of possible outcomes. 4. Narrowing down the list by conducting 2 rounds of Delphi surveys, asking participants to rank the importance of outcomes. And 5. A consensus meeting of stakeholders to finalise the core outcome set, which stakeholders agree should be the minimum data set collected in trials for people living with MCI. Standing on the shoulders of giants. Our first step was to look at what outcomes other researchers have reported in interventional trials for people with MCI. There are thousands of studies and hundreds of reviews which report the outcomes of interventions for people with MCI. So to make our review focused and feasible, we decided to do an umbrella review, where we reviewed studies published in systematic and scoping reviews of interventions. For a study to be included in the review, they needed to use standardised criteria for diagnosing MCI, such as the Peterson criteria, and report outcomes of people with MCI after completing an intervention of some kind. For each study, we go to the original paper and extract verbatim all of the outcomes they've used, e.g. global cognition, and how they were measured, e.g. ADAS-Cog. Through the review, we're developing a list of unique outcomes, trial or study outcomes that have a distinct meaning. We're now at the stage where we're trying to decide on what constitutes a unique outcome, rather than multiple names for the same outcome. For example, is attention the same as concentration and focus? How about psychological well-being versus satisfaction with life? Once this is done, we'll publish our findings in a review paper, and the list of outcomes will be included for consideration in the core outcome set. Learning from the best. A key concept in a core outcome set is that stakeholders should be involved in the decision-making process. By reviewing what's been done before, we capture most likely what researchers, funders, and possibly peer reviewers think are the most important outcomes. But there are many other people who need to have an input here. Most importantly, patients living with MCI and those who support them. So, we're recruiting 50 study participants to share their experiences of what matters most to people living with MCI, and asking them what outcomes we should be measuring and aiming to improve in interventional trials. It's very possible that what matters to patients, those who support them, such as relatives and partners, and those who provide key services, such as healthcare professionals, differ to what has historically been measured in research. We'll analyse the interviews and extract the outcomes, and add them to the list of unique outcomes that we're developing from the review stage. Putting it all together, once we finish with the review and the interviews, we'll have a very long list of outcomes which could be potentially included in the core outcome set. Many of these will be very important, but it's unrealistic to expect researchers to collect them all. And it's unreasonable to ask participants to sit through incredibly long assessments during studies to measure every possible outcome that might be important. To get the core outcome set, we'll need to narrow down the list. To do that, everyone we interviewed, plus about 75 more people with lived or professional experience of MCI, will be asked to rank the long list of outcomes in terms of how important they think each outcome is. We'll do this twice, with outcomes that most people want included being included, and outcomes that the majority of people think are less important being dropped. By the end, we're still anticipating that there might be too many outcomes, or some disagreement between participants. So we'll invite a selection of participants to share their views and reach consensus in what we'll include in the final core outcome set. The process is lengthy, but it will ensure that the patient and public voice, as well as the voices of researchers, clinicians and other relevant professionals who support people with MCI, are at the heart of this core outcome set.
Thank you for listening. Join the dementia research bloggers and share your own views.